Hi, another venue change as I decided to talk a little bit about healthcare. You know, the Republicans are doing everything they can to gut healthcare. They don't like the Affordable Care Act. I understand that. I mean, it was a wonderful bill, but it had flaws. But it has taken money out of their pockets, or at least it had until the insurance industry basically started to fund them to try to overturn this bill. And they're gutting it and they're doing everything that they can. And the reality is that the overwhelming majority of people in the country don't want the bill overturned. They want health care. And I decided to go with a different direction on this one because I said that I was going to be a little bit more authentic this year and talking about these types of things, and I'm going to be. During the campaign of 2016, Ted Cruz, who at that time was somehow running third, I don't even know how he got that many votes. But anyway, he was running third, and his wife basically left her job for a while. And you know what? He got on the exchange. He and his wife got on the exchange. And what was his reasoning? Well, we have to have health care for our family. Think about that for a minute. We have to have health care for our family, so we're getting on the exchange. That's what pretty much most people are saying. We want to have health care for our family. Not everyone works at a company that pays for their health care. The entire country deserves to have health care. Now, you can always pay for more health care if you want quicker access. But I can't believe that we're still one of two major countries in the world that doesn't offer free health care to its citizens. Sure, taxes will go up, but so what? And there are a few people who will say, well, why should I be paying into a system I'm not going to use? Because you're going to use it at some point. You may have that emergency appendectomy that you need. You may not have the ability to pay for cancer drugs that you need or other pharmaceuticals. Single payer really is the only way to go if you're talking about reducing healthcare costs. You just got to be realistic and you got to face that. And I know what some people have said, well, the federal government can't do this, can't do that, whatever, that healthcare is going to degrade. You realize that the United States is basically not even in the top 40 for best healthcare in the world. Let that sink in. Why? Because in a lot of places, costs are too high and other things happen. I live in a Syracuse area, and I don't know how many years it's been that we have the highest rate of babies dying after birth. And we've got some pretty good hospitals here, but something's happening. And, you have to basically look at everything at one point and say that you can't keep griping about the cost of healthcare and yet killing it for everybody else. Single payer is just the way to go. It eliminates so many problems. And the only one who can really fix a lot of these problems, strangely enough, is the federal government. I'm going to be writing a blog post about this, but I just wanted to get this down in video now to say that we really need to start thinking about this. We just do. Now, you can debate me if you want to. Go ahead. Comment down here. Comment wherever else I post this thing. Let me know why you think we don't deserve it. And if your answer is we can't afford it, you know what? You have no idea what you're talking about. I've been in this business 34 years. You want to compare? Let's talk. But this really is the way to go. They can figure it out to do it right. Medicare works after all. So that's my thought. Y'all let me know what you think, and I will talk at you later.